No, don't hold it. So I just got back from the hospital from my surgery. They said it went fine. But I am super pissed off and annoyed just because, first of all, I hate being a patient. I worked in healthcare for 22 years and I hate being on this side of things, even though it's really nice that I can have the surgery and have everything go well, or what appears to be well as of right now. One super important thing to know is that it's extremely difficult to put any blouse on. So if you're going to wear something after a rotator cuff surgery, get it several sizes too big in order to be able to put it on. Basically, I had to drape my clothes and go top naked underneath, which annoys me a lot, but what do you do? I guess some people don't care about that kind of thing, but I do. And a bra, totally out of the question. So right now, I'm at home in my recliner, draped with a towel, and I have my pain pump, my bandages, my sling, all of the contraptions. There's no point in telling part of the story without telling the whole story. So one of the things that I'm a little bit annoyed about that I will get over, and I'll get over it soon, is when I prepared to go into surgery, and they gave me the gown and pants and all of these things, and they said, oh, you can keep your underwear on and all of that kind of stuff. As soon as they rolled me into the operating room, I said, I have to go. I have to pee. And I was told several times, oh, you're fine. We'll take care of it. You're fine. You're fine. You're fine. So in the past, because I used to work in operating room, I know that it was common practice to straight cath patients, just to straight cath all patients who are going under anesthesia, simply because you have to be intubated, you have to and you lose you just, all of your muscles relax and all of these things. Mind you, I told them ahead of time. I said I have to go. So when I woke up in the operating room, barely, not an operating room, but the recovery room, first thing I was told was, oh, here are your underwear. You had a little accident. So, that's like a whole lot of information, but it's good to know. Don't wear your underwear into the operating room, simply because with propofol, you lose, your ability to control that function. And that's just something good for people to know. I'm just going to be raw. And so that pissed me off a whole lot, because I already said, hey, I have to go. And then for that to be the very first thing that I hear when I wake up. And then followed by, oh, it's fine, and oh, we see it all the time, but you know, it could have been avoided. It really could have. So I'm not going to dwell on it. However, if it helps anybody, that will be great. That will be absolutely great. Don't wear your underwear into the operating room. And because I worked in healthcare for so many years, I kind of figured, oh, well, they'll just take them off and they'll straight cath, you know, because this is what they've always done. However, surprise, surprise, they don't straight cath anymore. So you're going into the operating room and you just, if you pee on the table, you just pee on the table, which I think is freaking bizarre. I understand that it's, you know, it decreases the risk of infection, but seriously, excuse me, to just, you know, I don't know. I guess there's no perfect way to handle a situation like that. So anyway, that was my experience with waking up from anesthesia. Right now, we'll get off of the whole operating room pee saga. So, I'm here at home in my recliner, and literally right now there is a oh my goodness, my nose is super dry from the oxygen. There is a strap around my neck, and there's also a strap around my waist in order to hold the sling, which is kind of stiff. I can't feel my arm because I have the nerve block, which is the medication in this pump around my neck. My hand does feel tingly, but my arm, I don't feel. I feel some spots, but I don't feel my entire arm. And then there is a strap. Yeah, I said there's a strap around my waist. So with all of this contraption being what it is, there is no putting on a blouse or anything. I don't know how I would seriously be able to do that. So it's going to be improvising for at least a couple days. This patch right here under my neck, that's where they anchored the catheter for the nerve block, and apparently I'm supposed to pull it out within the next 3 days. So gotta be super careful with that because I don't want to feel the pain. I did want to have surgery, but word to the wise, don't fall in the shower. Seriously, nobody fall in the shower. So anyway, I was kind of pissed off, kind of annoyed, and tired of hearing, oh, it's, you know, it happens, and, you know, that's just, it's really difficult to hear those things when I understand because of, you know, because I used to be a healthcare provider. However, those are things that I don't want to hear simply because it's really difficult for people who take care of others to be on this end of the situation. So anyhow, sorry about the super angry video, but that's how I was feeling, and I'm sure I'll get over it tomorrow when I do a video on my 1-day progress. So I'm cold, but I have blankets and have a pillow, and I have ice or ice pack. For some reason, they did not deliver my polar pack, and it's Friday, so we won't be able to figure out where it is until Monday. So woohoo about that too. All right, so anyway, just wanted to talk about my experience. And so far, we were told that the surgery went really well. Apparently, they found bone spurs on my collarbone, and we were told that they corrected that situation since they were already in there. So, good deal. All right. Till tomorrow. Later.